This talk is about pattern reversal visual evoked potential interpretation. It is intended for the clinical neurophysiology fellows at Nick Laus Children's Hospital. I will conduct this talk by showing you a pattern reversal visual evoked potential study and asking you to choose the correct answer. Then I will show you an abbreviated step-by-step approach to finding the correct answer, hopefully the same one as you had chosen. Please stop the video for a second and take a look at this study. The question is, what is the cause of P100 delay? A. Bilateral prechiasmatic lesion. B. Bilateral postchiasmatic lesion. C. Technical issues. D. Uncorrected visual acuity. The abbreviated approach to reading pattern reversal visual evoked potential studies I use consists of 5 steps. I refer to the first step as verification, to the second step as numbers, to the third step as analysis, to the fourth step as interpretation, and to the fifth step as conclusion. Now I will explain each of these steps, starting with verification. Verification consists of asserting that the wave generated by pattern reversible visual stimuli corresponds to evoked potentials and that computer tagging of the landmarks thus generated are correct. The first part of verification is making sure that the study is readable, making sure that the landmarks of the two trials are no further than 5% of each other in time, and amplitude goes a long way in deciding the readability of a study. This first step is clearly met in this study. The second part of verification is based on pattern recognition. Having seen many pattern reversal visual evoked potential, you develop a sense of what is right and what is not. Drawing conclusion when patterns do not make sense leads to error. Hence, when patterns do not make sense, the cause of the incongruity between our mental picture of recognizable patterns and the variant in front of us should be looked for and, if found, corrected. In this study, the distance to N75 is very much increased, but the distance between N75 and N145 is normal. It's about 70 milliseconds, and the morphology of the wave look good. Such presentation is usually not associated with neurological pathology of the visual pathway or with eye or retinal issues. Thus, the reason is most often technical. It is tempting in this situation to work with what we have and continue following the steps of the abbreviated approach to reach a conclusion, but it is best to label the test unreadable and do it again with a special attention to the technical issues that caused the problem to begin with. In this frame, you see 4 panels. All parameters used for pattern reversal visual evoked potential were kept the same except for the monitor type and the response time of the liquid crystal display monitors. Regardless of the response time of the liquid crystal display monitors, cathode ray tubes monitor have displayed shorter P100 latencies than those latency displays displayed with liquid crystal display monitors. Notice that when cathode ray tube was used, P100 occurred at 107 milliseconds, whereas when liquid crystal display was used, even with a response time of 2 milliseconds, the P100 occurred at 114 milliseconds. If you buy a new machine, unless you buy the same model and the manufacturer have not changed a specification, you need to make and to have new controls. There are certain definitions that are important to know regarding monitors. One of them is response time. The response time is the time it takes for a pixel to change from one color to another. It is given in milliseconds. Input lag is the delay between the time an image is presented and when the image is displayed. And refresh rate of a monitor is the speed at which the monitor's image changes. It is given in hertz. So the answer to this question is C. Thank you for your attention.